Hi guys, my name is Nadine. I am just here because I wanted to make this video for my fellow nursing students, or maybe you're doing your prereqs and you're getting ready for nursing school. I am actually in a nursing program. I felt that I should make these videos because I have recently, well, not recently, I've been watching a few YouTubers on here that are in nursing school or are already an RN. So I just felt I needed to make these videos to give some kind of advice, or just to have for my personal use, so I can look back at this and see how I was doing at that particular time. And I think watching other people go through their journey really inspired me, and I hope to do that for others. And that's really all I want to do, and I hope that I can be of help to anyone who watches this video. I am 22 years old. I just finished my pre-semester of nursing school. For my program, it's still part of the nursing program, what I just did. My program is just a little bit different. It is a 2-year ADN program, so you will get or I will hopefully get my license as an RN along with my associate, so it's called an ADN, so Associate Degree in Nursing. So what I just did, I took pharmacology and I took a nursing skills and assessment class. So pharmacology is all basically about medication and learning the drugs and learning what they do and what they're used for, and different kinds of drugs, different classes of drugs, that whole jazz. And nursing skills is basically learning the very basics of nursing, which is more hands-on. All your vital signs, that's a very basic skill that you must know. I think the most difficult we had to learn this semester was putting a urinary catheter in. And it is very crucial that you maintain sterile field, obviously for safety reasons of the patient. So basically nursing skills is just all about learning the basic skills. We learned our lung sounds, our bowel sounds, our heart sounds, the five points of your heart. You'll learn that. Well, in my program, that's what we learned. Basic patient care and hand hygiene, patient room isolations, all the different kinds of isolations. This is just from the top of my head that I could just remember. So yeah, I actually finished this semester about a week ago. So now I've been chilling for a week and I've been relaxing, and I actually do work. So for my final for nursing skills, we had to do a comprehensive final, and we also had to do a skills, kind of like a skills exam in front of an instructor. So our main skill was the head to toe assessment. This is kind of like this is my note sheet, more or less. It wasn't my actual grading sheet here, but it's just a head to toe assessment, and that was part of our final for the nursing skills class. And we also had 2 randomized possible tests that we had to perform in front of our instructor on our patient. So these are all the tests that we had to basically know, because they were just going to choose 2 randomly. And then again, 2 random tests were vital signs. We definitely need to know our vital signs, so that was definitely a biggie that we had to test for. And urinary catheter, transferring from bed to wheelchair, PPE, bed making, and administering a small volume enema. So that was our final for our nursing skills. we didn't necessarily have a final or comprehensive final for pharmacology. It was just like another test on 3 chapters that we did. So it was not bad. I passed both my classes, so it was such a relief because it's just stressful. Nursing school in general, I feel, is mainly stressful, not so much hard. It's just because they expect you to be amazing, which I expect me to be amazing as well because we are taking care of people and have some individuals' lives in our hands. So it is safe to say you need to expect yourself to be amazing, and it is stressful, and you just need to find ways to de-stress and kind of get your mind away from school, nursing school, once in a while. What I have found is exercise, even though you're tired. I love Zumba. I love to go at my gym to my gym and go Zumba out, and it's just like you don't think about anything in there except dancing. So that's always nice. Or just music, or I watch YouTube videos. I can watch YouTube videos for hours. So bad. Or Friends. I love watching Friends. Um, so yeah, just you have to definitely take that time for yourself. Get your toes done since we can't change our nails because we have to have them short. Obviously no color. So I splurge on my toes now. But yeah, different things. Starbucks. I love coffee. That is like my thing right there. I can drink coffee for days. And yeah. So nursing school overall, it is so far, it has been stressful, and it is at the end very rewarding. When I got on my head to toe assessment, I did get a 97%. I was so happy. I was like, oh my gosh, I could hug you to my instructor. I was over the moon. And it is rewarding when you know that you can do something and you have learned something and you can make even a little difference. You're valuable, and each semester as it goes by, you learn more and more, and it's a liberating thing for me, and it's a great thing to be able to understand and learn and be able to help others, and just knowing that you're capable, and it's just all rewarding to me in the end. Anyway, so my phase that I'm in right now, I am in summer. Oh, my back. I am taking summer off. I have already taken the classes that I needed this past semester before I begin clinicals, so I can afford to take some off because I have no more classes except my first process, which that's what I was going to get into. My school is a process. It's weird. Nursing process 1 to nursing process 4, and you graduate with your RN degree. My graduation date is spring of 2017, so in about exactly 2 years, I should be graduating from my college with my RN degree and my third associate's degree, because I do actually have 2 other degrees, one in math and science and the other in liberal arts, focusing on social and behavioral sciences. Um, that's just because all these prerequisites, I just added so many different units and I had the opportunity to graduate, and so I did choose that route. So I actually have 2 degrees before I have my RN degree, which, you know, it is what it is. It's great, and I'm very proud. I'm just really ready for that RN degree. So right now, like I said, I'm just waiting for fall semester to start. I start in August, and that is nursing process 1. And this is when we actually start going to clinicals and going into the hospitals and really getting with the patients and getting some hands-on experience, along with lecture and lab, of course. But tomorrow is actually my mandatory meeting before our NP1, probably talking about all our vaccinations that we need to get, our physicals, our books that we need to purchase, and I'm so excited to get all the books, the book list, so that I can start reading up on it and just really preparing for NP1. I'm also preparing for my math test we have to take in about a month. We have to get 100% on our math test every semester, and it's dosage and calculation type math. It's not like algebra, it's not like any other math. It's this math is so, oh, it just can get confusing really easily, and then it's just, and the fact that we have to get 100% every time is nerve-wracking. So that's my yeah. Hold on, my dog. But just a second. Okay, I'm recording now. Okay, so like I was saying, the math dosage and calculations, we do need to get 100% on every test. We have 3 chances to pass. 2 are on our computer, and the last is with our instructor when we start that following semester. So for nursing skills, I would say this was very handy. A bunch of CDs showing each skill done correctly. Let me get this. There's so many actually. And I believe I got this on Amazon for like $8. And it just shows you like how to do vital signs properly, asepsis, what do we do? Hygiene, urinary elimination, indwelling catheters, oxygenation. I'm sure we're going to be using this in future processes because we have not learned injectable medications or how to do that per se. So yes, this was very helpful for me in learning the skills. It's Clinical Nursing Skills Taylor's Video Guide. $8. And this book here, my teacher basically said this is where I'm getting all my test questions from and the lecture. This is Health and Physical Assessment in Nursing. It is the second edition. Donita D'Amico is the author, I believe. This is the Clinical Pocket Guide. She used this because she has said in previous experiences with nursing students that they actually take this to clinicals because it just has tons of information and kind of like good reminders of what to look for and how to do certain things, like listening to lung sounds. So it shows you the different areas there. It just shows the different areas that you listen for the lung. This is the Weber's test. This was actually one of my possible tests that I had to remember. It's basically using a tuning fork placed on the patient's head here on the frontal lobe. Yeah, just little tests like that is very handy. I'm definitely going to take this to clinicals just in case I forget something, I forget how to do a test, or I forget what this means, and I could just slip this in my scrubs and I'm good to go. My plan over the summer, I'm going to keep refreshing all my skills so that I can continue to do very well in them by our clinical day. And especially the catheter, that's very tedious, and you gotta remember every step and make sure you're, keeping your sterile filled. Pharmacology, we did have a few math questions on our tests just to kind of prepare us because we're going to be having math questions in NP1 and so on and so forth till we graduate. So I actually, from one of my nursing girls on YouTube here, hey Rona, she's amazing and she actually already graduated and is working as an RN now, but I was watching her videos as a nursing student. So she recommended this book for dosage and calculation practice so that you can get better. To be honest, I haven't really looked at it yet. I've read a little bit, but not really. And I'm still in the midst of practicing for my test. Also, we were given these books too. This is one of maybe 5 or 6, I forget how many. This is for pharmacology. The ATI version, it's pretty thick. Just basically going over different medications affecting reproductive tract, some dosage and calculations, practice, the antidepressants, and just different things. I want to definitely look over this during the summer because we didn't really do much of that. We looked over our other book, which I actually already returned. It was just a pharmacology. I forget which book that was exactly. I believe that is all I desire to share. Yeah. So, like I said, I am just making these videos in hopes to inspire others, or maybe if you don't know anything about nursing school and you're getting ready for nursing school and you just want to see someone in nursing school, like that's how I felt, and I just wanted to just see how people were and how they acted, if they were stressed out, and like I just wanted to be prepared, and I just nursing is in my heart, so I just wanted to know anything and everything about nursing and nursing school and nursing students and how they cope and etc., etc., etc. So that's kind of what I'm making this video for, if there's anyone else crazy like me, and also for personal use as well. I just want to look back at this moment in my life and see how I was doing and just hopefully get encouragement and uplift myself through this. So yes, if you have any questions or concerns or need me to talk about anything else, please let me know and I will be more than willing to help. Like I said, I've always told one of my girlfriends, she's getting ready for nursing school herself, like if I can help even just one person, it is worthwhile. Just, letting them know what to expect, letting them know what to prepare for, and just giving them encouragement and, encouraging words and praying for them and hoping that they do their best. And I hope we all make it, to be honest. And yeah, like I said, if anyone dares to venture a question, I would be more than happy to help you out. Thanks. Bye, guys.